Psychiatry for 8th semester students of the Faculty of Medicine, Psychiatry. In the 8th semester, medical students will study psychiatry with a focus on diagnosing, managing, and treating various mental disorders that can affect both adult and pediatric patients. Here is a detailed explanation of the psychiatry curriculum for semester 8-1. Definition of psychiatry. Psychiatry is a branch of medicine that studies mental, behavioral, and emotional disorders in humans, as well as the medical and psychological approaches to treating these issues. The primary goal of psychiatry is to diagnose, manage, and treat patients with mental disorders in an integrated, evidence-based manner. 2. Learning objectives for psychiatry in semester 8. In semester 8, medical students are expected to understand various common mental disorders affecting adults and adolescents. Learn diagnostic methods in psychiatry, including psychiatric interviews and psychiatric examinations. Master therapeutic approaches for mental disorders, including the use of pharmacological treatments, medications, and psychosocial therapies. Understand ethical principles when treating psychiatric patients. Be able to handle psychiatric emergencies, such as patients with behavioral disorders or suicide risk. 3. Main topics in psychiatry. 3.1. Fundamentals of psychiatry. Introduction to mental disorders. Students will learn about the classification of mental disorders based on DSM-5, Diagnostic and Statistical Manual of Mental Disorders, and the relationship between psychiatric disorders and biological, psychological, and social factors. Psychiatric examination. Techniques used in psychiatric interviews, which include obtaining medical and psychosocial histories, and conducting a mental status examination to assess a patient's mental state. Mental status examination. An assessment to evaluate emotional, cognitive, and behavioral conditions of the patient. Medical and social history. Gathering information about family background, medical history, risk factors, and the patient's social situation. 3.2. Common mental disorders. Depressive disorders, major depression. Symptoms include low mood, loss of interest in daily activities, feelings of hopelessness, and somatic symptoms such as sleep disturbances and changes in appetite. Dysthymia, a long-term depression that is not as severe as major depression but still significantly affects daily life. Management. Treatment with antidepressants, SSRIs, SNRIs, and psychotherapy such as cognitive behavioral therapy, CBT. Anxiety disorders, generalized anxiety disorder, GAD. Excessive and persistent anxiety about many aspects of life. Panic disorder. Intense anxiety attacks associated with physical symptoms such as shortness of breath and rapid heart rate. Post-traumatic stress disorder, PTSD, occurs after an individual experiences traumatic events, leading to nightmares, flashbacks, and extreme anxiety. Management. Treatment with benzodiazepines for acute anxiety, SSRIs for chronic anxiety, and psychological therapy, CBT, exposure therapy. Bipolar disorder, bipolar I, characterized by severe manic episodes that disrupt normal functioning, followed by depressive episodes. Bipolar II features hypomanic episodes, less severe mania, combined with depressive episodes. Management, mood stabilizers, lithium, valproate, antipsychotics, and psychosocial therapy. Schizophrenia and psychotic disorders. Schizophrenia, a disorder that causes delusions, false beliefs, hallucinations, false perceptions, and disorganized thinking. Management, treatment with antipsychotics, clozapine, risperidone, and psychosocial support. Personality disorders. Antisocial personality disorder, characterized by behavior that violates social norms, lack of empathy, and absence of guilt. Borderline personality disorder, characterized by emotional instability, intense interpersonal relationships, and fear of abandonment. Management, psychodynamic therapy, cognitive behavioral therapy, CBT, and medications for specific symptoms, e.g. antipsychotics for paranoid behavior. 3.3. Therapeutic approaches in psychiatry. Pharmacological therapy. The use of psychiatric medications to manage symptoms of mental disorders, such as antidepressants, SSRIs, SNRIs, antipsychotics, mood stabilizers, and anxiolytics. Psychotherapy, cognitive behavioral therapy, CBT. Therapy focused on changing maladaptive thinking patterns and behaviors. Psychoanalysis, therapy that delves deeper into underlying issues, often focusing on past experiences and unconscious conflicts. Group therapy involves multiple individuals with similar problems, guided by a therapist. 3.4. Behavioral disorders and psychiatric emergencies. Psychiatric emergencies includes patients with suicidal tendencies, violent behavior, or severe behavioral disorders requiring immediate and appropriate management. Suicide risk assessment, identifying signs and symptoms of patients at high risk for suicide. Management of behavioral disorders, handling patients with severe behavioral disorders or physical violence using safe and structured approaches. 4. Psychiatric practical training and clinical skills. Psychiatric interview. Students are trained to conduct psychiatric interviews with patients, using active listening techniques and appropriate information gathering. Mental status evaluation. Students practice assessing the mental status of patients by examining various aspects such as orientation, affect, thought processes, and perception. Psychiatric case simulation. Simulations are used to train students in managing cases of mental disorders, including treatment planning and crisis management. 5. Ethics and communication in psychiatry. Informed consent. Respecting the patient's right to be informed about their condition and the treatment they will undergo. Psychiatric stigma. Students are also taught about the stigma that often surrounds psychiatric patients and how to overcome it by providing empathetic, non-discriminatory care. Psychiatry in Semester 8 aims to provide a comprehensive understanding of mental disorders and the best ways to manage psychiatric patients with a humanistic and evidence-based approach.